Let's see pediatric conditions, starting with neurological disorder, hydrocephalus, abnormal accumulation of CSF in a cranial cavity. When there is an excessive secretions of a CSF fluid, it is a common condition. And high-pitched cry, Manchau sign, crackpot sound, sun-setting eyes, irritability, poor feeding, bulging of anterior frontally, dilated scalp veins are common signs and symptoms. If there is a dilated scalpel veins and bulging of anterior frontally, we need to make the baby in a semi-fowler's position. Treatment: VP shunt, signs of malfunction, lethargic, irritable, pupil changes and poor feeding. The next condition is spina bifida. This is due to the folic acid deficiency in the mother. Neural tube defect, it is a congenital problem, can be identified during the anomaly scan. In these babies, we can notice like inconsistence of a bowel and bladder movement. The baby will have neurological developmental lacking, abnormal growth and developments. There are three types of spina bifida. The first one is occulta, that is tuft of hair. Second one is fluid, spinal fluid, that is meningocele. Third one is meningomyelocele. This one is because of nerves in the collection of in the spinal cord defect. The baby will be having hydrocephalus complication and tuft of hair. This one, the treatment is like aseptic dressing. Make the baby in a prone position, avoid supine position, don't do any powder or ointment dressing. Cerebral palsy, in this there will be a multiple brain developmental problem will be noticed. Delayed milestone, abnormal posture of the baby, scissoring cross position, irritability, curing we will be noticing. Treatment: intrathecal baclofen, botulinum toxin to reduce the rigidity. Management: safe environment. Respiratory disorders: crop, laryngotracheal bronchitis, hoarseness of voice, barking cough, stridor, respiratory distress, cyanosis. Treatment: humidified oxygen and nebulization. Epinephrine we will give 0.5 milligram before any kind of chest physiotherapy. Asthma, lower airway hypersensitivity, infection, airway, allergy disorders, stress or cold disorders. Treatment: humidified oxygen, albuterol nebulization, administered epinephrine. Bronchiolitis, respiratory syncytial virus, mode of transmission, contact. Management: high fluid intake, administer acetaminophen and ribavirin. Gastrointestinal disorders: hypertrophic pyloric stenosis, a condition that occurs when the pylorus, the muscular opening out between the stomach and the small intestine in the duodenum, the muscles is becoming stenosis, that is an pyloric stenosis. Projectile vomiting, visible peristalsis movement, olive shaped mass in the abdomen, dehydration, malnutrition we will find out. Treatment: pylorotomy. Management: NPO, IVF, burping and monitoring the abdominal distension. Next is Hirschsprung disease or aganglionic megacolon. Aganglionic megacolon, the cells will be getting damage or improper growth, so that is an aganglionic cells. In this condition, the baby will have a ribbon like stool, failure to thrive, failure to pass meconium, abdominal distension, vomiting, refuse to suck, everything. Complication: enterocolitis. Interventions: we need to keep NPO, observe the abdominal girth, make the baby for colostomy care. Intussusception, a life-threatening illness occurs when a portion of the intestinal fold like telescope with one segment to the other slipping inside. This is an condition where the baby needs enema push. A non-surgical treatment will be done and to make it into the normal position. Here also we will see red jelly like stool, sausage tubes, dancing sign, abdominal pain, everything. Developmental dysplasia of hip, this one while the baby is born or during the pulling of the baby through the birth canal, or while the baby is in breech position, turning the baby by using the leopard maneuver, the baby will get into the developmental dysplasia of hip. In this time, the hip bone acetabulum is dislocated in the pelvic bone. This time there is a two types. Acetabular is a normal subluxation, incomplete, and dislocation is a complete displacement. Diagnosis: ortholannis sign we will be finding, Barlow's sign, abduct of the pain, we cannot apply the posterior force to the knees. Trendelenburg position, the baby will be having a pelvic, one is uplifted and the other one is down. Interventions: we will make the baby in a pelvic harness, hip spica placement, and changing the position frequently to the baby to prevent any kind of skin injuries. We have a cyanotic conditions, obstructive defect, atrial septal defect, ventricular septal defect. PDA treatment: idiomethacin, surgical closure. This one, when the baby is born, the baby is not getting a proper closure of an atrial septal defect, ventricular septal defect, and PDA. Atrial stenosis, the aorta is getting stenosis and the not adequate blood circulation is happening out of a left ventricle. Due to this, there will be consumption of excessive blood in the left ventricle, and the baby will get left ventricle hypertrophy, ending up with left heart failure. Pulmonary stenosis, this will be in a pulmonary artery. The same condition, the baby will be developing into the right ventricle hypertrophy, right ventricle failure, heart failure. Atrial stenosis, aortic valvectomy is the condition procedure. Pulmonary stenosis, we will do pulmonary valvectomy, coarctation of aorta. In this, we will find the baby is having different blood pressures in upper and lower limb. We will do the resection and anastomosis in this condition. Tetralogy of Fallot, it is an 4 disease condition. It's a syndrome where a ventricular septal defect will be causing a pulmonary stenosis, overriding of aorta, and ventricular hypertrophy. In this condition, we can check the severity of condition and the baby's procedure can be adjusted according to the need. Up to 3 years of age, we can make this condition procedure. Acute cyanotic, the baby will have blue spells or tet spells. Clubbing of fingers, boot shaped heart. Position, knee chest position and squatting position will give to the baby. Tricuspid atresia, absence of opening. Transportation of great arteries. When the two main arteries are mislocated, the baby will be having a very difficult blood circulation. Truncus arteriosus, single blood vessels comes out of both right and left ventricle. We will check the peripheral pulse and we will give supportive therapy to the baby. Kindly contact us if any doubts. Thank you.